Good evening, everyone, and welcome to Pharmacology quiz. Good to see nearly 40 players online. Gunpowder, Abhi, Sesha, Sweta, Bahu, Soumya, Chitti, Tarun, Dr. Ram, Kim Jong-un Jr., His Excellency, the North Korean President. Chutki is also online. Welcome, Chutki. And Pravalika, Sairam, and many more. Vilok. शुरू करेंगे Tambola. Let us see who is going to be the winner of 40,000 rupees of online MBBS.com video library, 65 full-scale grant tests, 30,000 MCQs, topic-wise Q scanner and question bank, and daily live online interactive session. Everything which is meant to make you become the toppers. Let's make the great start, doctor. Even if someone of you is little late, you can be able to go to kahoot.it and enter this PIN number. Let's start. Good luck to everyone. 3, 2, 1. Beta-1 selective antagonist. Which one is beta-1 selective antagonist? Include all except. It's a very standard MCQ. You should know everything, anything about the beta blockers classification, doctor, if you want to crack a top rank in the tomorrow's NEET PG. Very good. Excellent. 16 of you have correctly answered. Acebutolol, bisoprolol, esmolol, they're all beta-1 selective. Beta-1 is in the heart, beta-2 is in the lungs. All of you know. There are 2 lungs, beta-2. 1 heart that is meant to be given to only 1 person in the world, that is beta-1. So acebutolol, bisoprolol, esmolol, they're all beta-1 selective, but not timolol is what you need to remember. Shweta rocks. Thor, one more Shweta, Shweta 2, Sid and 001. Excellent, doctor. Now, non-selective, alpha and also beta antagonist is which drug? Punch your answer, doctor. Today we should reach at least 60 online viewers. That is my goal. Non-selective alpha and beta antagonist is which one? Boom, boom, boom. Who is the winner? "22 of you are right. Propranolol, timolol, bisoprolol don't qualify that. Carvedilol is a non-selective alpha and beta antagonist is what you need to remember. That brings Sid to the top, very close to Shweta. Let us see who is the winner. Which of the following beta blocker, it combines cardiac selective beta-1 blockage along with the stimulation of the other beta receptors and activate nitric oxide synthetase in the vasculature, and it decreases the systemic vascular resistance. Only one beta blocker qualifies with all these properties, doctor. It stimulates the beta-2 receptors and activate the nitric oxide synthetase in the vasculature and decreases the systemic vascular resistance, which is very good for the heart. 29 of you are born to become the cardiologists. Excellent, doctor. Nebivolol. One more advantage of nebivolol, don't forget. If you are having a patient who is having bronchial hyperreactivity, like bronchial asthma, to manage their hypertension, angina, nebivolol is a wonderful drug, especially those who have a prohibitive bronchial hyperreactivity. You should not forget a very common clinical practice point. Very good. Now, doctor, that brings Sid to the top. Oh, Shweta, you need to fight back. Appu came into the 5th position. Excellent. So, doctor, now we come to very important table. एक photo ले लो, a screenshot ले लो, कुछ भी करो, मगर मन में रखो एग्जाम को जाना जरूर एक क्वेश्चन बीटा ब्लॉकर क्लासिफिकेशन के ऊपर नहीं आए तो मेरा नाम मुरली भरद्वाज नहीं है. Beta 1 selective antagonist, acetylol, which is a partial agonist, atenolol, betaxolol, bisoprolol, esmolol, and metoprolol. Non-selective beta antagonist, where beta 1 is equal to beta 2. Nadolol, pindolol, which is a partial agonist, propranolol, and timolol. Non-selective, both alpha and beta blocker, carvedilol and labetalol. And nebivolol combines the cardiac selective beta 1 adrenergic blockade with stimulation of the beta 3 receptors and activates the nitric oxide synthetase and lead to vasodilatation and decrease the afterload. And very, very helpful for a strained heart is what you need to remember. Theophylline. What is the class it belongs to? Come on. Question looks simple. Answer bhi hona hai simple. Whoever first answers is going to beat the competition. Theophylline is. What is theophylline? Beautiful. I know what is the most common wrong answer. Only 11 of you have correctly answered. Bravo! This is the rank-breaking question, right? क्वेश्चन इज सिंपल, इतना लंबा भी नहीं है, फिर भी उसी के अंदर चमत्कार है. सो डॉक्टर मोहन, मोहन की लीला दुनिया को. वेरी गुड मोहन, एक्सलेंट. सो डॉक्टर, Roflumilast, one more सिंपल दिखने वाले क्वेश्चन, आंसर उतना सिंपल नहीं है. Who is going to answer the correct? Come on, doctor. Unless I play a game with you all, हमको भी नींद नहीं आएगा. At 10 p.m. unless I play a game in the morning 10 o'clock with you, the day doesn't start. आप लोग मेरे लिए भी बहुत एडिक्शन बन गया. वेरी गुड, वेरी गुड, वेरी गुड. 54 आंसर्स. आई एम सो प्राउड ऑफ यू. 25 of you correctly answered. PDE4 inhibitor is what you have to be 100% sure. मेरे प्यारे चिट्टी सेकंड पोजीशन में आ गया. Pooja is also really racing. She's a very good jockey. Excellent, doctor. Sildenafil, Vardenafil, Tadalafil, Avanafil. What are they? Which class do they belong to? ये सब आंसर करने के बाद ये तो कोई भी आंसर करेगा. अरे वाह, 55 online players, warriors. Please invite more of you. more of your friends every day and win 40,000 rupees. You don't need to waste money on any other coaching program. Dr. Murli Bharadwaj is born to make you the topper. Sildenafil, Vardinafil. This I know all of you will kill the answer. But who kills faster is the greatest killer, Bahubali. 36 of you have correctly answered. Sildenafil, Vardinafil, Tadalafil, Avanafil, they're all PDE5 inhibitors is what you need to remember. Very good. Pooja is really racing. Now, doctor, whenever there is an acute decompensated heart failure with cardiogenic shock, which class of these drugs is being used? Punch your answer, doctor. In acute decompensated heart failure with cardiogenic shock, which of these drugs is used? Boom, 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 real excitement. Once this quiz is over, you all should get motivated to go back to the onlinembbs.com video library. There are 35 hours of video lectures in pharmacology discussing 1200 MCQs, topic-wise classified, along with the PowerPoint of notes. Everything is there in the onlinembbs.com video library. Excellent. 30 of you rightly answered. This quiz, it's not all about coming to the first position. The spirit is to participate, to fight. Spardhaya Vardhate Vidya. Competition should expand knowledge and intellectual curiosity to fight back. So, Dr. Thor is really picking up. Mohan is maintaining his crown. Maverick is the fast climber. Very good, very good. Milrinone is the PDE3 inhibitor we are talking about, which is used in decompensated heart failure, is what you should remember. In the vascular smooth muscle, which drug increases the cyclic AMP? Then smooth muscle has a myosin light chain kinase. It inhibits that so that it leads to vasodilation. And it decreases the preload and also the afterload. Which class of these drugs we are talking about? Easy question after you answered all that. Of you are right. PDE3 inhibitors. PDE3 inhibitors. This all describes that. So Mohan is still on the top. 001. Afternoon he snatched away the top prize and subscription. Very good. So doctor, you should know Milrinone is a PDE3 inhibitor. It increases cyclic AMP, it increases calcium influx, increases inotropy and chronotropy. Whereas in the vascular smooth muscle, it increases cyclic AMP, it leads to the inhibition of the myosin light chain kinase, it leads to vasodilation and decreased preload and afterload. That's the reason we use the Milrinone in acute decompensated heart failure with cardiogenic shock, is what you have to remember. Now, doctor, which of this increases cyclic AMP? Neutrophils, granulocytes, bronchial epithelium, That is the reason you use it in severe COPD. Which drug it is? Excellent. So, phosphodiesterase inhibitors have multiple roles depending upon which phosphodiesterase do they inhibit. That is most important for you to recognize. Can you check that? Very good. 18 of you correctly answered PDE4 inhibitors. Very good. Mohan is not yielding his position. He's strongly sitting there. Very good. N. Prakash is the highest climber. So, Doc. Roflumilast is the PDE4 inhibitor. It increases cyclic AMP neutrophils, granulocytes, and bronchial epithelium, and it is used in severe COPD, is what you have to remember. Okay? Now, cyanopia, blue-tinted vision, is the adverse effect of which drug? Beautiful question. Who is going to give me the correct answer is going to become something, a promising upcoming NEET PG topper. Cyanopia. Very good, very good. So, a very good number of you. Excellent, doctor. 27 of you have correctly answered. Sildenafil, only sildenafil in this class carries this adverse effect of cyanopia, is what you need to remember. Very good. Mohan is still maintaining top rank. भैया मोहन, आपको आपके क्राउन से निकालना हमारे बस में नहीं हो रहा है. Very good. Sairam is now racing forward. Pooja is also doing good. Sildenafil only lead to cyanopia because it inhibits PDE6, phosphodiesterase 6 in the retina, is what you need to remember. Which of these is used in benign prostatic hyperplasia? Punctuate answer, doctor. Boom, boom, boom. Which one do you use for benign prostatic hyperplasia? Punch your answer. The faster you punch, you are going to be the winner. Simple. Like Boomrah does the bowling. If you do the bowling, you are the winner. Very good. 13 of you are right. Tadalafil is the one among this class which is used in BPH. Whoa, Mohan, 10,382 points. Mohan made. हम बुमराह के बारे में बात कर रहे हैं, मोहन ने हैट्रिक मार दिया. बढ़िया. Proud of you, Mohan. Now, doctor, sildenafil, vardenafil, tadalafil, avanafil, they're all PDE5 inhibitors. They decrease the hydrolysis of cyclic GMP. So, they increase the cyclic GMP. That leads to smooth muscle relaxation. They increase the nitrous oxide activity. They lead to pulmonary vasodilation. That's the reason they are used in erectile dysfunction, pulmonary hypertension, and tadalafil is also used in BPH is what you need to remember. But they're all vasodilators. That's the reason they can be facial flushing, headache, dyspepsia, hypotension, especially if the patient is taking nitrates. Same time, if you give him sildenafil, वो severe hypotension में चले जाएगा. So you got to be 100% sure. The last question for the evening, which is going to decide the winner. What is a wrong statement about theophylline? Very fast punching is required. Otherwise, you lose the mark, even if you are right. Come on, Docky, where are you? Doctoro Italia. Boom, boom, boom. Punch your answer. Great. That makes the Mohan to be on the top of the hill. Chitti, Pooja, Saira, Maverick, everyone who participated really played well. So, Dr. Theophylline is a non-specific PDE inhibitor. It decreases cyclic AMP hydrolysis, so it increases the cyclic AMP. It leads to bronchial smooth muscle relaxation. But what is the problem with theophylline, doctor? Toxicity is very, very bad. Cardiotoxicity in the form of arrhythmias. Neurotoxicity with headache, abdominal pain. You should not forget about theophylline. So, a lot of students, we are all enjoying playing, but I want to see 300, 400, 500 people to play this game. तब बहुत मजा आएगा. So please make this viral. It is all there in your hands. Tell your friends, hey, हम दोनों मिलके मुकाबला लड़ेंगे, कौन जीतेगा देखेंगे. चलो आओ, मुरली भारद्वाज का कौन बनेगा पीजी पति प्रोग्राम. Morning 10 a.m., 2 p.m. and night 10 p.m. Tomorrow we have 3 subjects: ENT, ophthalmology, and preventive medicine, otherwise called sleep promoting medicine, SPM. So, doctor, let us see what happens next. Yay. I believe the screen is not really moving. Okay. All right. Mohan is the winner. My screen is not moving forward actually. So please give a big clap to Mohan. And Mohan, please take a screenshot and send it to our helpline, and you will get an activation of 40,000 rupees worth of onlineMBBS.com video entry. Thank you all and enjoy a great evening and a wonderful night. Life is so beautiful. The most meaningful thing in the life, most valuable, precious thing is we are alive. That is most important. Don't worry. मुझे क्या रैंक आएगा, मैं क्या बनूंगा. You will definitely become great. You are born to become great. That's what I like to tell to all of you. 6 महीने में एग्जाम है, 5 महीने में एग्जाम है. No problem. We will all work together. We will play every day. We will study every day. And then one day we will become topper. With that wonderful dream, have a good night and a great night.